I cry right along with the patient when I have to do this. Yes, manual disimpaction of constipated and hard stool in the rectal vault is what I hate to do the very most. It's so very painful to the patient, but it has to be done sometimes. Generally, no one tells you how to do it. This is an invasive procedure that should only be done if other steps to avoid constipation have been started, like giving oral laxatives and stool softeners. Please watch our other videos about bowel care so you never get to this place with your patients. But if you find yourself having to disimpact a patient, let's look at that procedure. Now, let's talk about some important notes before you begin. Do not perform disimpaction if there is a suspected bowel obstruction or perforation, if you see severe hemorrhoids, or the patient has had recent rectal surgery. And always follow your facility's protocol and the doctor's orders that are in place. It can be so uncomfortable, it must be done gently. You're going to monitor the patient closely for pain, distress, or bleeding, and stop immediately if you need to, especially if there's extreme pain or resistance. Make sure you've already discussed the need and the expected procedure with the patient and the family or any caregivers that are going to be present. Gather the supplies you're going to need ahead of time. Gloves, consider double gloving. Lubricant, like a water-based KY jelly. Disposable bed pads, a bedpan, absorbent brief, or a commode nearby. And just in case the patient might be able to complete the bowel movement once you've stimulated them. Washcloths or disposable wipes, a protective gown if you want to, and a drape sheet for the patient's privacy. Again, explain the procedure. Calmly explain to the patient what's going to happen. And even if they're nonverbal, you want to maintain their dignity, reduce their anxiety, and know what's ahead. So you're going to position the patient on the left lying side. This is called the Sims position. And the knees should be slightly bent. You might put a pillow up on the upper back to support them, and even have that right leg forward over the left to maintain that side lying position. Use a bed pad underneath to protect the linens. After washing your hands and applying the gloves, put a lot of lubricant on your gloved index or middle finger. You're going to gently insert your finger into the rectum and, moving in small circular motions, break up and remove the small amounts of stool a little at a time. Allow the patient time to relax, proceed slowly and gently. Coax out the pieces of the stool with your finger if possible, and take breaks as needed. If the patient is in distress or discomfort, pause frequently and reassure them. Encourage the patient to push during the removal. They might be able to do it themselves. Sometimes it's necessary to insert two fingers, the index and middle finger, to grasp and pull the stool out, but it's going to be more painful. It's also effective. Be careful, move slowly, remove as much as possible, and then consider inserting 1 or 2 bisacodyl suppositories so the body's peristalsis can continue the defecation. Of course, clean up and provide the appropriate clothing and positioning. Make sure you record the procedure, amount, the consistency of stool, the patient, how they did. Report any significant findings, severe pain, blood, and make sure that your medical team knows about it. And of course, start a bowel program to prevent this from reoccurring. That's it. Don't put yourself in the position of having to disimpact your patient. I hate crying with my patients, so I am very vigilant in keeping track of their bowels. Make sure you have a clear and regular bowel management plan in place, and don't you dare add a narcotic without marrying a bowel program to it. This is Nancy, one of the care queens with the Hospice Care Queen, Hospice Care Plan. Click on the link below, get our booklet. It's got everything, and it's got QR codes that'll take you to the videos of more bowel management information. We are there for you because care is treatment.